3 bottles, on the shelf inside a medicine cabinet. Tylenol, Advil, a small bottle of low-dose aspirin. You take one when a knee acts up after gardening, another before bed when your back is stiff. The aspirin every morning, because a doctor told you to 15 years ago, and you never stopped. You have been doing this for years, maybe decades, and no one has ever sat you down and explained that those 3 bottles are not equally safe for your kidneys, not after 65, not in the same body, not at the same time. Here is what most adults over 60 have never been told. Older adults who take common over-the-counter NSAIDs, the family that includes ibuprofen, carry more than 2.5 times the risk of acute kidney injury compared with people who don't take them. In one large cohort of adults 65 and older prescribed these medications, roughly 1 in 6 experienced kidney injury or a dangerous potassium disturbance within 30 days. That is not a rare event. That is a widespread pattern in millions of medicine cabinets right now. And here is the part nobody explains. Of the 3 painkillers on that shelf, the one most adults reach for first carries the largest kidney risk in older bodies. And the one most people quietly worry about, the daily baby aspirin, turns out, at the dose used for heart protection, to be the gentler choice. The story most adults have been telling themselves about these 3 bottles is upside down. Every week on Inside Aging, we translate the medication research. Your 15-minute appointment never has room to explain the interactions your kidneys have been quietly absorbing for years. Stay to the end. Number 1 on the countdown is the single finding that changes how these pills should be taken for the rest of your life. Almost every kidney injury from these medications in older adults shares the same fingerprint, and it isn't the one most people would guess. If what comes next helps explain something about your body that nobody has ever fully connected for you, take 1 second and hit the like button. When you do, YouTube shows this to thousands of other adults over 60, quietly making the same choices. You could be the reason someone's mother gets 1 more decade of healthy kidney function. That is what a like does on a channel like this one. Now, before we go any further, there is something to try. Right now. It takes 30 seconds. Hold one hand out, palm down. With the other hand, pinch the skin on the back of the outstretched hand, a small pinch, between thumb and finger. Hold for 2 seconds. Let go and count how many seconds it takes for that pinch of skin to flatten back down completely. This is called the skin pinch test. It is not perfect. Skin loses elasticity with age, so a slow return does not always mean dehydration. But if it takes 5 seconds or more to flatten, especially paired with darker urine or a dry mouth, it is one early hint that the body is running drier than it should be. Write your number in the comments below. That is a starting point. At the end of this video, there is a specific protocol. Retest yourself in 14 days and post your new number as a reply. Because everything about to be explained rests on one quiet truth. The pill alone is rarely the villain. The pill plus a body running low on water, that is the story. So what is actually happening inside a kidney when someone swallows an Advil? The kidneys are not a passive filter. They actively control their own blood supply, making thousands of small adjustments every hour to keep filtering pressure steady. To do this, they rely on chemical messengers called prostaglandins. Think of prostaglandins as the kidney's emergency dilator. When blood pressure dips, when someone is a little dehydrated, when they stand up too fast, prostaglandins kick in and tell the tiny vessels feeding the kidney to open wider. The kidney keeps filtering. Ibuprofen, and the whole family of non-steroidal anti-inflammatory drugs, or NSAIDs, works by shutting down prostaglandins. That is how it relieves pain. In a 30-year-old kidney with full reserve, losing that backup barely registers. In a 68-year-old kidney already running at half its old capacity, losing that backup matters enormously. And that half-capacity number is not an exaggeration. Between ages 30 and 75, humans typically lose about half of their functional nephrons. the tiny filtering units. A young adult carries roughly 990,000 per kidney. By age 70 to 75, that number falls to about 520,000. Roughly half of adults over 70 have a kidney filtration rate that would meet the definition of chronic kidney disease if it appeared in someone younger. The loss is quiet. Standard blood tests can miss it because the marker they use, creatinine, is produced by muscle, and older adults have less muscle. The kidney can lose meaningful ground while the lab report still reads normal. That is the terrain the pills are landing on. Tylenol, which is acetaminophen, works on an entirely different pathway. It barely touches kidney prostaglandins. That is why it does not reduce inflammation the way Advil does, and why, at normal doses for normal durations, older kidneys generally handle it more easily. The danger with Tylenol shows up somewhere else, at high cumulative doses, chronic daily use, or when people unknowingly stack it on cold medicines that also contain acetaminophen without saying so on the front of the box. And then the aspirin. This is where almost everyone is surprised. At the low dose, a cardiologist puts someone on the small 81 milligram tablet. Aspirin does not suppress kidney prostaglandins the way a full-strength NSAID does. In older patients with chronic kidney disease, low-dose aspirin has generally not shown the kidney harm that full-dose NSAIDs cause. In some analyses of adults 70 and older with existing kidney disease, low-dose aspirin users had lower rates of kidney failure, not higher. That does not mean aspirin is harmless. The bleeding risks are real. In 2022, the U.S. Preventive Services Task Force actually recommended against starting aspirin for the first time in adults 60 or older for prevention of a first heart attack or stroke, because at that age, the bleeding risk outweighs the cardiovascular benefit. Anyone currently taking aspirin from years ago should have that specific conversation with their own doctor. But on the narrow kidney question, at low preventive doses, the evidence is fairly reassuring. Here is where the story sharpens. The pill, on its own, is rarely the villain. The real villain is the combination. The pill plus a diuretic, the pill plus a stomach bug, the pill plus a heat wave when nobody remembered to drink water. Every one of those situations narrows the kidney's blood vessels from one direction. The NSAID narrows them from the other direction. And the older kidney, with its half-strength reserve, has nowhere left to go. The pattern shows up in the nephrology literature so often it has a nickname, the triple whammy. Consider Michael, 68 years old, retired engineer, active, walked 3 miles every morning. Michael is a composite drawn from patterns that appear in the case literature over and over, not a single individual. He had been on a small dose of a blood pressure medication for years. Standard stuff, no problems. Then he caught a bad case of the flu. 3 days of fever, sweating, barely drinking water. On day 2, his lower back started seizing up from lying in bed. He took 2 ibuprofen. The back loosened. He took 2 more that night. The next morning, still feverish, 2 more. By day 5, the flu was lifting, but his ankles were swollen and he felt foggy in a way the flu did not explain. Labs were drawn. His creatinine, the standard kidney marker, had sat at 0.9 his entire adult life. It was now 2.1. His estimated kidney filtration had dropped by more than half in 4 days. From an over-the-counter painkiller he had taken 100 times before without a problem. Michael had acute kidney injury. He recovered, as most older adults in that situation do when the pattern is caught early. But his baseline kidney function never quite returned to where it had been. He lost ground. He is not getting back. Michael did not do anything reckless. He took a normal dose of a drug sold without a prescription. He just took it on top of a fever, dehydration, and a blood pressure pill in a body that was 68 years old. That is the story playing out in tens of thousands of older adults every year. NSAIDs account for roughly 15% of drug-related acute kidney injury in older adults. and the vast majority share the same fingerprint. 3 quick things adults over 60 hear all the time, and what the evidence actually shows. Myth: if your blood pressure is controlled, your painkillers are safe. False. Blood pressure medication manages the number on the cuff. It does not repair the vessels feeding the kidney. 2 entire classes of common blood pressure drugs, the pril family, like lisinopril, and the sartan family, like losartan, actively narrow kidney blood vessels from one direction for a specific therapeutic reason. Adding an NSAID narrows them from the other direction. When a water pill is also in the mix, one nationwide hospital study found the risk of hospitalization for acute kidney injury climbed to nearly 9 times higher than in unexposed patients. Myth: aspirin is the harshest painkiller on the kidneys. The opposite is true. At the low 81 mg dose used for heart protection, aspirin does not suppress renal prostaglandins the way a 400 mg ibuprofen tablet does. In older adults with existing kidney disease, low-dose aspirin has generally not shown the kidney damage most people expect. The real trade-off with low-dose aspirin is bleeding risk, not kidney damage. Myth: a few days of ibuprofen can't really hurt you. Not true. Acute kidney injury from NSAIDs does not require weeks of use. It can appear within the first 2 days of starting them, particularly during a sick day, or in someone dehydrated, or in someone on a blood pressure medication. In older adults, the danger window opens quickly, and it opens quietly. Here is what all of that means, specifically, right now. 5 things adults over 60 need to know about painkillers and the aging kidney. Counting down from 5 to 1. Number 1 is the finding most people have never heard, and it is the one that changes how you take these pills for the rest of your life. Number 5. Tylenol is the gentler everyday choice for older kidneys at normal doses, but a large 2024 study out of the University of Nottingham should give anyone taking it regularly some pause. Adults 65 and older on prolonged prescribed acetaminophen showed a 19% higher risk of chronic kidney disease, a 36% higher risk of lower gastrointestinal bleeding, a 9% higher risk of heart failure. This does not make Tylenol NSAID level dangerous. It means the assumption that acetaminophen is completely free of consequence at chronic doses is no longer supported by the newest data. Anyone taking Tylenol most days of the week for chronic pain needs a conversation with their doctor about total acetaminophen exposure across every medication, because it is also hidden in cold medicines, nighttime sleep aids, and combination prescriptions. Number 4. Ibuprofen has a short danger window most people are never warned about. Kidney injury from NSAIDs does not always require weeks of use. It can show up within the first 2 days of starting them, particularly if someone is dehydrated, sick, or on a blood pressure medication. Even short courses, 1 or 2 weeks of regular NSAID use, measurably raise the risk of acute kidney injury in adults over 60 compared to no use. 5 years from now, the people who keep reaching for ibuprofen casually through every flu, every back spasm, every long flight, will be the ones with rising creatinine numbers, blood pressure that suddenly stops responding to their medications, and conversations with their nephrologist that did not need to happen. Number 3. The painkiller plus the blood pressure pill is one of the most common and least explained collisions in modern medicine. Any medication ending in pril, lisinopril, enalapril, any medication ending in sartan, losartan, valsartan, any water pill, a diuretic. These narrow the kidney's blood vessels from one direction for a real therapeutic reason. An NSAID narrows them from the other direction. When a diuretic is also on board, it is the triple whammy, and hospital data show the mortality rate at 1 year among older adults hospitalized with this specific injury pattern was nearly 39%. Tens of millions of adults over 60 are on these combinations, often without anyone at the front desk explaining the interaction. Please consult a doctor before continuing an over-the-counter painkiller alongside a blood pressure medication. Number 2. Low-dose aspirin, the tiny 81 mg tablet, appears in older adults at cardiovascular prevention doses to be gentler on the kidney than full-strength NSAIDs. In adults 70 and older with existing kidney disease, low-dose aspirin has generally not worsened kidney outcomes the way full-dose NSAIDs do. That does not mean anyone should start aspirin on their own. In 2022, the U.S. Preventive Services Task Force changed its recommendation and now advises against starting daily aspirin for the first time in adults 60 or older for primary prevention, because at that age, the bleeding risk outweighs the cardiovascular benefit for most. Anyone currently taking aspirin should have this conversation with their own doctor. But on the narrow question of whether the morning baby aspirin is quietly damaging the kidneys, the evidence does not strongly support that worry at low preventive doses. And number 1, the finding that changes everything. The pill is rarely what damages an older kidney on its own. The pill plus dehydration is what does the damage. A large proportion of NSAID-related kidney injuries in adults over 60 have dehydration somewhere in the picture. Sick day vomiting, a long hot afternoon in the garden, a flight across the country, a flu with 3 days of low fluid intake, a new diuretic, a skipped breakfast and a skipped water bottle on a busy morning. The older kidney can usually handle the pill. It can usually handle running a little dry. What it struggles with is both at once, in a body that is 68. The pill is a stress test. Hydration is the safety net. When the net is thin, the test is harder to pass. Here is one statistic worth holding on to. In healthy 70-year-olds with no diagnosed kidney disease at all, roughly a third of the tiny filtering units inside the kidney are already scarred and out of service. That loss is often silent. It does not always show up on a routine blood test, especially in someone with less muscle mass than they had at 40, because the standard marker, creatinine, is produced by muscle. Someone can lose a meaningful share of kidney function and still have a lab result that reads acceptable. That is how quiet the erosion can be. How old are you right now? Write the number in the comments below. Just the number. The risk from these painkillers does not rise gradually with age. It rises more steeply after about 60, and again after about 70. If you are in your 50s, you have a window to change how these medications are used before the kidney has lost much ground. If you are in your 60s, the window is smaller but still wide open. If you are in your 70s or 80s, every decision about these pills matters more than it did a decade ago. Put your age. It tells the community where you sit on that curve. Now for what to actually do. This is the 3 Rules Kidney Protection Protocol. 3 rules, 3 habits, that is all. Rule 1. The 48-hour pause. Anytime there is sickness, fever, vomiting, diarrhea, a bad cold, a stomach bug, anything that means eating less, drinking less, or sweating more, consider stepping away from ibuprofen, naproxen, or any NSAID for those 48 hours. If pain relief is needed during that window, acetaminophen at standard label doses is usually the gentler option on the kidney. If a blood pressure pill or a water pill is on board, call the doctor and ask whether to temporarily hold those during the illness. This single rule prevents the majority of NSAID-related kidney injuries that show up in older adults every year. Please consult your own doctor before adjusting any prescription medication. Rule 2. The hydration habit. Most adults over 60 are running mildly dehydrated more often than they realize. This is not carelessness. Thirst becomes a less reliable signal after 65. The body simply does not warn the brain the way it used to. Chasing a specific number of ounces is not the point. Building a habit is a glass of water with breakfast, a glass mid-morning, a glass with lunch, a glass mid-afternoon, a glass with dinner, less coffee and less alcohol than the body wants. On hot days, when sick, or after any exercise, more. Rule 3. Match the pill to the pain. For everyday aches in older adults, at standard label doses, acetaminophen is generally the easier choice on the kidney. NSAIDs may still be appropriate for specific situations, a short flare of arthritis, an acute injury, when used briefly, carefully, and with adequate fluid intake. Chronic daily NSAID use, month after month, is where the risk compounds. This is a real conversation to have with a real doctor. Please do not change a medication routine alone. The next time there is an appointment, bring this specific topic in. Mention every over-the-counter painkiller being taken, every combination product, and every day of the week they show up. That single disclosure is often the most useful thing a patient can bring into the room. There is one more thing worth raising with a doctor. Most basic kidney blood tests rely on the marker called creatinine. Creatinine works reasonably well, but in older adults with less muscle mass, it can make the kidneys look healthier than they actually are. A different blood test, called Cystatin C, is far less affected by muscle mass and often picks up kidney decline earlier in older adults. It is not part of routine blood work in most practices. For anyone who has been taking NSAIDs regularly for years and whose standard kidney numbers always come back fine, it is worth asking a doctor whether a one-time Cystatin C would give a clearer picture. One conversation. It might reveal something a standard test cannot. Now, back to the first thing we did together, the skin pinch test. Whatever number went in the comments, that was a starting point. Follow the 3 rules for 14 days. Drink water more deliberately. Step away from NSAIDs when sick. Talk to a doctor about which everyday pain reliever fits your body best. Then do the pinch test again and post your new number as a reply to your first comment. The number will likely change. Skin elasticity will not return to what it was at 30. Age is age. But the speed of that return can shift when hydration improves. It is one small signal among many that the body is in a better place than it was 2 weeks ago. Here is the truth that nobody likes to say out loud. The medical system is built to manage one problem at a time. Someone brings in joint pain, they leave with a recommendation for an NSAID. Someone brings in blood pressure, they leave with a pill that narrows the same vessels the NSAID narrows from the other side. Nobody at the front desk asks whether they are also taking ibuprofen for a bad back. Nobody pulls the threads together. That is not because doctors do not care. It is because the system is built to treat each piece in isolation. Kidney health after 60 is the place where every one of those one piece at a time decisions meets. And nobody is in charge of that intersection except the person living inside the body. You now know what a doctor would likely tell you if there were time for the full conversation. You know how the 3 pills differ for an older kidney. You know that dehydration is what turns a normal dose into a real problem. You know the 3 rules. You know the test to ask about. If this video has changed the way even one bottle in your medicine cabinet gets thought about, share it with one person in your life over 60. Your husband, your wife, your father, your mother, the neighbor who takes ibuprofen every night before bed. That share is an act of love. It is the kind of quiet act that protects someone you care about for years. Every week on Inside Aging, we go through the research your 15-minute appointment never has time to explain. The interactions, the trade-offs, the quiet things happening inside a 65-year-old body that never make it into the exam room. If that is what you have been looking for, subscribe now and turn on the bell. That is the only way YouTube will make sure the next one lands in your feed. Take care of those kidneys. Protect them now while they can still protect you.